Hi, I'm John from Physio. I'm one of the physiotherapists here. We've been asked today what an avulsion fracture is. An avulsion fracture is where a piece of bone gets pulled off where the attachment of the tendon from the muscle occurs. This generally occurs through adolescence. So here's an example of a muscle pulling off the insertion on the pelvis. This is sartorius muscle. It's attached to the tendon and it pulls a plug of bone away. During your growing years, before puberty finishes, the bone is actually softer than the strength of the muscle in the tendon. Now, pelvis injuries are actually really common sites for avulsion fractures. You can get them around this area. These are all muscle attachments, where your hamstring attaches, even where your stomach abdominals attach, and then certainly all through any of your groin muscles, and can even get some through here where your gluteals attach. Another common area where we can get avulsion fractures, but more likely we'll get an apophysitis, which is basically a partial pull away of the bone, is around the knee. The tibial tuberosity is a really common zone, and that's where we get a condition called Osgood-Schlatter disease. Another condition is Sinding-Larsen-Johansson disease, which is at the inferior pole here of the patella. Both of those conditions rarely result in an avulsion fracture, but they can be managed by active rest. Avulsion fractures are actually quite easy to manage. The first thing we generally do is rule out with an x-ray to see how big the distance is that the bone has been pulled away. If it's close, nature will just heal it. Sometimes we do need to get them surgically fixated, but otherwise we just adjust things via protective mechanisms such as taping, braces, reduced exercise, and good old ice. So for more advice about avulsion fractures or apophysitis, seek the advice of your physiotherapist or your doctor.